Guys, my name is Dr. Joshua DEXHEIMER. I'm the VP of Product and Education at Styku. At Styku, I get the opportunity to work on a product where we are focused on pioneering the next generation of non-invasive imaging technology for the purposes of providing a screening assessment tool of the human body, of how we can use 3D body scanning plus human digitization, right, to assess not only health, but also human performance. That potentially by integrating 3D body scanning as a health screen, okay, can ultimately increase human lifespan and enhance human longevity. Now, what about from an athletic standpoint of view? So they're doing year-round assessments with EMG sensors, force plates, sprint timers, metabolic units, the list goes on and on. But they're also using different camera technologies to assess range of motion and risk of injuries. So 3D body scanning is something that could be missing from this, and we know that anthropometrics, right, provide a rich data set of information around human performance. But we know that from this anthropometric history that we can understand that the shape of the body, right, actually can provide a map to its internal state and function. And at Styku, we take these centuries worth of anthropometric science plus our software to help people further understand their bodies. So we have a health module within our software. And so a patient might scan, and then we provide them an estimate based off of their body shape metrics, things like waist circumference, waist to hip ratio, and others, of their overall risk of various chronic diseases. And into specific risk of chronic diseases. We have here cardiovascular disease, respiratory diseases, so on and so forth. The next step that we take is kind of intervention-based. How can your body shape change, right, and reduce your risk of various diseases? So ultimately, what we see is that by analyzing the data from the body shape, right, we can use this within this clinical setting to provide a more personalized treatment in this field and actually be preventative in nature. Now, what about athletic performance, right? So on the right-hand side, we have Sir Mo Farah, and on the left-hand side, we have Eliud Kipchoge. If you don't know who they are, they're very good distance runners. They've Olympians and have run the marathon in about 2 hours. What we see is that their body shape and their anthropometrics, even beyond their physiology, can predict their performance. Where we have seen, we've taken different body shapes and found that high quality distance runners are kind of sitting in between mesomorph and ectomorph. So, right, but are typically taller, leaner, and potentially even lighter. So these are CrossFit athletes. Well, we looked at those anthropometrics, but we found that lower body fat percentage plus longer legs, right, actually equaled a better workout score. So at the end of the day, that by creating this 3D digital representation of the body, so essentially we're creating an avatar, right, we can efficiently provide both health and or a performance screen that can enhance the prescription that's provided by both the clinician and the sports performance practitioner.